So Oakland has 8 operational homes, mostly across London and the southeast of England, with more sites on the way. We focus on delivering exceptional care, but still retaining that family feel. And as much as possible, we focus on using the most innovative and exciting technology out there to really deliver efficiencies for our staff and a great experience for our residents.
We have homes that are family orientated, because one of our ethos is that our homes have a family value. Our ethos is integrity, respect, and also being exceptional. And I think our homes are unique in the sense that all the homes under the Oakland brand are unique in their own ways to fulfill the needs in that geographical locations for that particular resident groups. At Oakland, the technology we use, and one of the technologies is Nexus. And this has really brought it to the forefront that unlike the technology we used previously in other care home groups, what Nexus does is it gives every carer and nurse a handheld device. And so when a resident needs assistance and uses their Nursecall system, for example, it's the handheld device that alerts every carer on duty as to what resident and which room, what location, so that the carers and the staff are able to respond immediately. And what it does, it also reduces the overall noise at the nursing station, and the handheld device is integrated that once you get an alert, the staff member is able to go into the room, respond, and all the time this is recorded so that we have an automatic record using the handheld devices. But it's also important that our staff have the technology to be able to assist those very residents. So, for example, technologies where if a resident needs assistance, they can ask for help using the technology within their bedroom. The staff members have handheld devices so that a bell or a loudspeaker doesn't announce it at the nursing station. The staff member can be anywhere in the building, whether they're doing doctor's rounds or giving personal care, but their handheld devices will let them know immediately, and they're able to then go to respond. So from a care quality point of view and from Oakland's own focus, it's important that we respond to the resident ASAP. So there's absolutely no delay.
Nexus is excellent for the residents because it means that we don't have loud call bells ringing throughout the whole home every time somebody needs some assistance. Gone are the days where there would be alarms down the corridors with things flashing every time somebody calls. Now we've got Nexus, which is installed on handheld devices that the carers use individually, and so the alerts flash up to them on there, creating a lot less noise for the residents, a lot less disturbance, but most importantly it means that the care staff are alerted quickly and so the residents can get the help they need quicker.
The handheld devices also help with care planning. So rather than wait at the end of the shift, a carer or a staff member can look at the care plans, use the progress notes to make sure it's updated. So as soon as a resident is assisted with personal care, this can be put into the handheld device rather than waiting for the end of the shift, because otherwise things can be forgotten. The other thing the handheld device does is that we have a program that allows them to give medication administration using those handheld devices, so the records are more accurate. It reduces the carbon footprint that we don't use papers and records, and all that is from a handheld device. And it was important that we look at the suppliers, we look at the competition and who would be best partnership to make sure that not only we have the latest technology in our homes over our competitors, but also the technology which we can gradually develop and increase its use so that it doesn't become obsolete within a few years.
The engineers at GHM are always friendly and helpful. Not every installation goes smoothly, and that's the nature of tech and systems, but they're always there to make sure it's working, really well by the end of the day. Ongoing support is very good, and even the senior team at GHM are very accessible, when required.